Hello, this is Dr. Park from UBA Plastic Surgery Clinic. During consultations, I often receive questions such as, how will my breast change 10 years after surgery? How will my breast change after childbirth? Do I really need to replace my implants after 10 years? These are questions I hear very frequently. So today, I would like to share a real case from UBA Plastic Surgery to show you how breasts actually change over time and to provide clear answers to these concerns. About 10 years ago, a patient visited our clinic for breast augmentation. At the time, she was single and experiencing significant stress about the size of her breasts. She came to us saying, "I wish my breasts were a bit larger." We performed breast augmentation surgery using 300cc implants to help her achieve her desired look. Here is her appearance 2 months after surgery. Next is her appearance 1 year after surgery. Compared to 2 or 6 months post-op, by 1 year, the swelling had significantly subsided and the lower part of the breast had settled into a more natural position. Recently, this patient visited our clinic again. I was so happy to see her, and as we caught up, she shared that she had gone through 2 pregnancies and had been busy raising 2 sons. Curious about her earlier results, she also wanted to look back at her old photos together. This is her appearance 10 years after the surgery. When comparing the photos from 1 year post-op to 10 years later, you can see that there has been very little change. Of course, slight differences in camera settings and lighting might affect the overall feel of the images, but the overall breast volume and contour have remained largely the same. Just because 10 years have passed, it does not mean that you automatically need to undergo another breast surgery or replace the implants. In fact, this patient remains very satisfied with her results, and since there were no issues, she only had a routine breast ultrasound and happily went on her way. So, what I would like to emphasize to everyone is this. First, if the breast pocket is properly created during surgery, the breast tissue will not sag easily over time. Second, the firmer the patient's natural breast tissue, the less it will be affected by the passage of time. As you saw in this case, because the patient had relatively firm breast tissue, even after 2 pregnancies, there was minimal sagging. Also, if appropriately sized implants are used, ones that do not overly burden the breast tissue, there is generally no need to replace the implants even after 10 years. Younger patients in particular should not worry too much. As you have seen today, even after 10 years, breast augmentation results do not show significant sagging or deformation, unless there is a major complication such as implant rupture or capsular contracture. Replacing the implants is not necessary. Even after childbirth, the shape of the breast remains largely unchanged. I hope this information has been helpful to you.